Hello, this is Tim McKnight, Dr. McKnight, also known as Dr. Tim. I'd like to welcome everyone back to my YouTube channel that's focusing on the health and wellness of our pediatric population through our line of health and wellness products. I also would like to welcome those who are viewing this content on my Instagram account, Dr. Tim's Wellness. Today, I want to talk a little bit about elderberry. And I think the timing of this video is perfect because we're about to enter into what I call the perfect storm as it relates to the typical wintertime viruses that seem to cause a lot of great deal of illness in our pediatric population. So this is the time of the year we have to gear up for RSV, influenza, as well as rising rates of COVID infections. So elderberry's been around for a while, and it's been known to treat a variety of illnesses, but most importantly, to boost the immune system for adults and kids. Before I dive into it completely, I just want to mention that the elderberry supplements um, really should complement a healthy lifestyle, but certainly not replace the healthy habits that you need to have to get past the winter season. So, what I mean by that is we need to practice good public health habits involving frequent hand washing, getting good sleep, eating a balanced diet, getting regular exercise, and staying well hydrated. And all of this should certainly not replace the need to keep your child's vaccines up to date. Okay, so we do have an elderberry gummy product that's part of our product line that can be found on McKnightMD.com. Please go to my website to learn more about elderberry and the other products we have available. We most recently have put some articles on our website, and feel free to read the articles and learn a little bit more about these supplements and some of their benefits. Okay, so what is elderberry? Elderberry is derived from the berries of the European elder tree, and there's many forms of it on the market today. You can find it in pill form. You can find it in lozenges. You can also find it in teas. But the form that's commonly used in pediatrics, I would say, is syrups as well as gummies. Okay, and our products are in the gummy form. Okay, so it's more tasteful and easy to administer to your child. Okay. So, what are the benefits of elderberry? And elderberry is a very popular topic right now, and I'll touch on that in a second. But there's a great deal of immune boosting nutrients that can be found in elderberry, such as vitamin C and antioxidants. And please keep in mind, elderberry really will help to lessen the symptoms of influenza illness, but it certainly will not prevent those symptoms from occurring. So it's key to remember that your child will probably get sick at some point during the winter, and elderberry should be taken over a matter of days, but not long term. But it will help your immune system fight off infection better, maybe faster, and you might experience fewer side effects. Now, elderberry is a very popular hot topic among some of the mothers out there, and I can tell you the popularity has grown primarily because there's been some recent data out there to suggest that elderberry might target certain viral illnesses. And in particular, there's data out there to say that there could possibly be a component of elderberry that is either anti-inflammatory or antiviral in nature. So it's been really known, or shown rather, to be very helpful as it relates to fighting off the influenza virus. And I also came across some other studies that showed how they would compare elderberry to TAMIFLU. And TAMIFLU is an antiviral medication that is given within the first 48 hours of having flu-like symptoms. And what they found was that elderberry was at least as effective as Tamiflu in terms of lessening flu symptoms and certainly reducing the risk of getting the flu after exposure. So there's a lot of good data out there on elderberry. We certainly need more scientific studies to be done on it. And I always recommend that my mothers have a detailed conversation with their pediatrician about starting any supplement on their child, okay? And certainly, elderberry is not a substitute for the influenza vaccine by no means. So please keep that in mind, okay? Now, elderberry is not FDA approved. It's actually regulated as a supplement, and it's not a drug. Okay, so I need to underline that fact to my mothers out there who are thinking that they're actually could be giving their child a drug per se, but it's not. Now, should you give your elderberry supplements to your children, please, as I said, talk to your pediatrician, and especially if your child is immunocompromised due to any autoimmune condition or is undergoing chemotherapy or may suffer from another underlying chronic health condition. So please have that detailed condition conversation with your pediatrician. And keep in mind, as I said, that there's no substitution for good public health measures such as good hand washing and also eating a healthy, balanced diet and getting adequate amounts of sleep. But I encourage everyone to go to my website, McKnightMD.com, to learn more about our product line of health and wellness products. That also includes the elderberry gummies. So once again, I appreciate your time. I appreciate everyone who's been watching. We've been getting some very good views on Instagram. And we do have specials running this fall where you can buy bundles of the product 2 at a time at a reduced rate. So once again, go to our website, McKnight MD, to learn more about our products. And until next time, please continue to live well and love life. Take care. Bye-bye.